proceed to this recording.
Have we started?
Yeah.
Okay, so my idea was, because I'm such a pedestrian, that
Do you know your top says hit the booze?
yes, it means hit the booze button, which means like stop drinking. You know, it's ironic. So I'm very ironic. Anyway, what we're here to do is, as a pedestrian, I wanted to ask you lots of questions, because you know I ask you lots of questions anyway when I'm not recording things. But I need to know lots of practical answers. I came into the doctor and itchy skin, and asked a question about menopause, and there's so many real questions and no real answers out there. So here are my real questions. Right. HRT, if I take HRT estrogel, as you know, and which is a bioidentical, and I want to know, do I have to take it for the rest of my life, or can I, do I phase it out? And if I phase it out, does menopause start again? Do I get symptoms back? So I wanted to ask you that.
So I think, can I rephrase that?
Yeah, obviously.
So I kind of think you're asking me, how long do you take HRT for? Well, I suppose the question is, why are you taking HRT in the first place? And there's different reasons for it. So, for instance, women may be taking HRT because they've got symptoms such as hot flushes, night sweats, itchy skin, concentration problems. And for those women, you would normally begin to tail it off maybe in their late 50s.
And then does your menopause start again?
Well, the menopause means having periods again, so no.
But will you get hot flushes and all that?
Some women do, some women don't. There doesn't seem to be a good way of stopping. Some women just stop totally, which seems not great, rather than tailing off slowly.
So your body gets used to it.
Yeah, but it doesn't appear to make a difference. And some women don't get return of the awful symptoms, and some women might. Now, we've got to be a little bit careful, because some women never stop taking HRT, and I've got lots of patients in their 70s and even 80s who are taking HRT because they feel pretty lousy without it. And
isn't it good for your bones to keep taking it?
Well, if you're taking HRT because you're worried about weakness of bones, bone prevention, osteopenia, which is bone thinning, or true osteoporosis, then we would normally keep a woman on HRT for at least 5 years, 5 to 10 years, and then the return on the HRT seems to dwindle. So if I was a woman who's 55 towards 60, then for osteoporosis protection, I'd probably begin to reduce the dose.
And your bones won't get thinner?
They will get thinner over time, but actually they won't get so thin it becomes a problem.
Okay. And if you do lots of weight-bearing stuff and weight-bearing exercise?
Yeah. Because bone health is dependent not just on hormones, it's dependent on your genetics and your lifestyle, other diseases. So it's really important to not smoke, not drink too much alcohol, take lots of weight-bearing exercise. And those are really good things to try and do to keep your bones nice and strong.
And not get overweight.
But actually, if you're talking about bone disease, it's being too thin. It's actually more important.
Oh, really?
Yeah.
Oh, okay.
Yeah, being too thin is more of an issue with bone disease than being overweight.
Is that because your bones leach out minerals?
No, it's because fat produces a little bit of estrogen.
Yeah, I just said that to someone the other day. They need to be a bit fatter.
Yeah.
Because you can tell when somebody gets wizened and a bit Nancy Reagan with a great big head. No offense, Nancy.
She
just
said
do
that,
it.
not me.
But people get super thin and they get a really big head and they go in like this.
It's genes that are so important, because some women will never get osteoporosis having never had HRT because they've got really good genes, and some people are just predisposed to bone disease, and in spite of what you do, they'll still get bone disease.
Like Ronnie Wood. Anyway, that's by the by. Anyway, now.
Do you know that?
No, but he's fierce. He's older.
But how do you know he's got osteoporosis?
No, he hasn't got osteoporosis, but he can has good genes because he's had this whole rock and roll lifestyle, and until he gave up all his
Did he go downhill when when he gave up everything?
No, he's lovely and fun and nice. But he doesn't, those people who can, like, take everything and do everything and be party
And
animals.
just be lucky.
And be lucky. That's what I'm saying. So
yeah.
you have that also in bone density?
It's kind of like smoking. It's like if you smoke, you are more likely to get lung cancer than if you don't smoke. But some people will smoke and never get lung cancer because they've got their genes that stop them happening. And other people will get lung cancer without smoking, unfortunately. But
don't smoke. Just in case you're not one of those people. Okay, so my other questions. How many years does the menopause last? So I think that you get menopause, perimenopause for like up to 8 years, 10 years. And that as like you build up to your menopause, and then you have menopause for like 3 years, and then it's over. So that's my rough time scale. Am I wrong?
No, you're never wrong.
No, obviously.
So no. So menopause. You make medically. You make the diagnosis of menopause when a woman hasn't had her period for more than a year.
But if you're like me, and I've been on the Mirena for 10, 12 years, so I haven't had a period for like 20 years or something.
It's more difficult, but you would probably say when a woman's 52 and not had a period and got Mirena that she's menopausal, so it's over. Now, you say the perimenopause is the time from when the periods start to become a little bit erratic, maybe...
Yeah, or when you start to get, like, you just start to be like an old person a bit?
No, you say when a woman's periods start to become irregular from about 43 to a year after her last period, that is the perimenopause.
That's the perimenopause.
That's the perimenopause.
And then the year after her last period, then that's the beginning of menopause.
So you can only say, it's the beginning of menopause, a year after the last period.
And menopause can, like, what's the tops amount of time menopause can last? Say you don't have HRT and you're just going through the whole thing.
So some women will continue having periods into the late 50s.
Oh.
And it's just a genetic thing. Other women will stop having periods naturally much younger than that. It's unrelated. One of the other things people always ask me, it's unrelated to when your periods start.
Oh, okay. I always thought it was.
That's unrelated to when your periods start.
Okay, because I got my menopause, my itchy arm menopause, when I was like 50.
Can I just say, that's not menopause.
What,
right?
when I got itchy skin?
No, that's the beginning of your perimenopause.
But I was 50.
Okay, but for most people, the beginning of their symptoms is not the menopause, it's their perimenopause. It's about when their menopause is going to happen.
So, perimenopause, is perimenopause a good time to start taking HRT?
I think if you're symptomatic, then yes, because...
So you can take it quite young?
Yeah, because my feeling about it is why feel lousy when you don't have to.
And it won't increase your risk of breast cancer if you take it from, say, when you're 43 till you're 55? That's not a problem? No. Unless your family are already genetically...
Yeah. So there's, again, with breast cancer, there's lots of factors that increase your risk. Age, genetics,
lifestyle,
weight.
Yeah.
So the biggest risk of taking HRT is the increased risk of breast cancer. There's no doubt about it. It's not nice, but that is the case.
How big is that risk?
Well, it depends on the individual, but what we do know is that the background risk for breast cancer is about 12 in 1,000 women. It goes up to about 15 in 1,000 women with estrogen and progesterone therapy, but only remains about the same at 12 in 1,000 with estrogen only therapy, which is quite interesting actually. But that's not nearly, and it's awful that there is an increased risk. But if you look at other factors such as alcohol and being overweight can take you from 12 in 1,000 to 30 in 1,000.
30?
Yeah, 30 in 1,000 risk of breast cancer.
So it's way worse than taking HRT in lots of ways.
Well, I don't know if you can compare them, but you can't say, well, you can do either or.
Yeah.
You can't say, I'm going to be overweight or I'm going to take HRT. But what you can say is the relative risks are quite different. And you can affect weight and reduce your risk of breast disease.
So if you're, say, such a pedestrian question, but if you're overweight and you drink wine, a lot of wine, and you have you take HRT, then you're putting yourself in more of a bracket.
There is, but the additional risk of HRT, if you do have those lifestyle risks, is is a little bit more, but the bigger ones are those lifestyle risks. And I don't think we should be preaching.
No, I'm not preaching.
You
I'm
did,
just
you did sound a
asking
bit preachy.
about what?
But smoking and drinking.
We
And
should
being
be smoking
overweight.
and drinking.
I know, but
if you've got menopause symptoms, this is my thing.
Yeah.
If you've got menopause symptoms and you feel really crap, and you're thinking, oh my God, it's all menopause,
Yeah.
but like, and you know, your kids are leaving home,
Yeah,
and your whole
yeah,
life
yeah,
is changing,
yeah,
and there's
yeah.
a million things wrong with you, and you throw in overweight, smoking, and drinking, then that's just going to compound your misery, right?
Well, people use them as supports, don't they? But I know what people no. But what we should be saying is that those are people's risks. We just accept that people are overweight or they drink whatever. What I'm saying is the additional risk of HRT is not that much.
I know, but you see, for me, a lot of the time when people talk to me about menopause and they come to me and they say, oh, my menopause is a misery, and sometimes it's not your menopause, it's the misery, it's your whole life.
Oh,
so
yeah.
if you clean up your life, and it's not that hard if you really focus on it.
We should all try. We should try.
But it makes you feel an awful lot better if you're taking care of that. I don't mean get skinny, but I mean like get healthy.
Yeah, no, true. And we should
healthy.
We should control the factors that we can control. Should we leave it at that?
Yeah. Okay. Right. I have another question. Wait. I've opened the phone. Right. How do you know when menopause is over if you're on HRT?
Well, I suppose the first question is that menopause is a line in the sand. It's 1 year after your last period.
And how long does that last?
Well,
we don't know.
No, after you've had your last period, you then post-menopausal.
Oh, so menopause is like a day?
But menopause is a made-up line in the sand. It's a year after your last period.
So is it during that year?
No, during that year would still be classed as the perimenopause.
So immediately after that, then you're done with menopause?
Well, I don't know, but you will still have symptoms. But for a medical person, you say that is the time when that's your menopause.
Okay, but for the rest of us,
yeah,
then it's like the symptoms can go on.
So we
for
should
how
talk
long?
we should talk about menopausal symptoms then.
Okay, so menopausal symptoms.
That's better.
How long do menopausal symptoms last?
Well, menopausal symptoms can, some women never have menopausal symptoms other than the alleviation of periods. Some women get.
Do you really? Are there many?
Well, I don't know. I don't know. There's lots of. I think so. I don't know. But there's, most women will have some symptoms. Few women will have no symptoms. And lots of women will have moderate to severe symptoms. I think that's fair. And those symptoms can last all through the 50s and sometimes into the early 60s.
So while you have those symptoms, it's safe to take HRT? If you don't have all the other factors.
Yeah. I don't think you can. I think safety. I think it's a relatively safe thing. Yes, absolutely.
Okay. Yeah. Okay. So long as you're, and that's why I then pontificate about the exercise and the lifestyle and the food and all of that kind of stuff, because if you do that, it'll really help your symptoms.
Yeah, it will do, and there's lots that one can do, because looking after yourself during the menopause, well, HRT, the bit that I get involved in is actually, just part of it really, because there's so much else.
But it's like when you're pregnant, if you're like overweight and you're smoking and you're drinking and you're doing all those things, you're going to have a really rubbish result, because you're going to feel really bad, you're going to be way overweight for ages afterwards, you're going to have like a whole psychological problem thing, because you didn't...
I think you can do lots of things to make your life better.
Yeah, and because we have all these raging... Do men have any hormones at all? Because we have all these hormone changes and your mood and all of that kind of business, then you've got to kind of do the whole healthy lifestyle thing.
Yeah, I think it's really. But it's really important to be as healthy as you can, because when you're, if you look at the average age of menopause being around 50, it is a time when you're thinking, really, what changes can I make to my life that are going to keep me in as good a shape as possible for the next 20 to 30 years. Well, and I think that's probably, and I think taking HRT is part of that, but it's only part of it because it's all the other stuff. It's health, it's relationships, it's all lots of other things that are important in health aged 50.
And it's a good time to take control of your health and your life in general, because your kids are growing up, everyone's leaving home, life is in a different phase, and it's a good time to kind of flick the switch and say, right, if I'm going to be around for another 40 years, it's like me.
I think it's a time when one can reappraise, can
Yes.
think again about your life, and I suppose maybe that's why people do all sorts of things in their lives, because it's a time of reappraisal.
Yeah, buy motorbike. No, so I think the
Have you just bought a motorbike?
no, but the girl version of buying a motorbike is getting your act together when you're
Is
50.
it?
Yeah, instead of having a midlife crisis, you have a midlife regeneration.
Maybe we should rebrand midlife crisis.
Hashtag midlife crisis. Okay, now when is the best time to take? Oh, well, first of all, before we ask that question, should everyone take HRT, or should some people just go through it and never have HRT?
No. So you've got to think about why you're taking HRT. So for you started taking HRT because you felt a bit lousy.
Yeah, and I had itchy skin.
And the itchy skin. Did your itchy skin get better with HRT?
Yeah, it went the same day.
Okay.
The day that I put the estrogel on.
Well, that's not a
And it
placebo
was
effect,
bad.
is it?
No, it wasn't. It wasn't, because I had seriously itchy skin. I had all that like cream, those dodgy creams in the bathroom, and I had everything. And my skin was got really sore. And I just remember my arms, because I used to scratch them all the time. The day I started estrogel, it stopped.
Okay, so there's women who take HRT because they will have symptoms such as itchy skin. They may have psychological issues, concentration, mood disorder. They may have the physical feelings of hot flushes, night sweats, can't get to sleep, terribly anxious, palpitations, vaginal dryness.
Oh no, it was all going that way. I didn't go anywhere near that section.
Okay, so those are
no rehab for me.
And some women will tolerate those symptoms. They'll say, fine, this is part of my life, it's part of being a woman, it's part of getting older.
Night sweats, man, they were quite serious. I had a couple of those, and they were quite like a lot more than you think they're going to be.
Yeah, awful. But some women will say, well, this is part of me, this is part of being a woman, it's part of being human, and I'm just going to deal with it. And that is absolutely fine. Other women will take HRT for medical reasons. The biggest reason is because of bone changes. So I think your question was how long to take it?
Yeah.
Well, I think everybody's different. And for the bone thing, I think, as we discussed, 5 to 10 years is a good time. For the symptoms, well, I probably would start thinking about tailing off a symptom relief at about 60. But as long as a woman knows potential risks and complications of staying on HRT past that age, then, well, it's up to them. It's a quality of life issue. And a balance about the pros of HRT against the risks of taking HRT.
So I think HRT makes your skin a little bit thicker, so you look less wizened. If that's a word. So, do you think, should I stop taking HRT when I'm 58?
I suppose we have to look at you as a whole.
Yeah, which is a lot. But, for instance, if I'm happy on it, why would I stop taking it?
Well, I'd say to you, the main reason not to continue taking it is because of the increased risk of breast cancer.
How much is that?
After you stopping it, it may last, that increased risk may last for 10 years.
After you stop it?
Yeah.
So what's the increased risk after, say, 60-ish in my world?
Oh, I don't know. That's a difficult one to say, but all we can be confident about saying is what the prevalence, the rates are of women on HRT and not on HRT, and it will be definitely higher than women on HRT, and that effect will probably last.
Significantly higher, or a few percentages?
No, as we were just talking about, from 12 in 1,000 to 15 in 1,000.
Oh, okay. So, right, all right.
But, women in their 50s should be on a mammogram program. And the other thing to mention about breast cancer, or on breast cancer, is breast cancer is not caused by HRT.
It's just
propagated. Yeah, so it's not an initiator of disease. It doesn't make the cancer happen. It's just that if the cancer's there, it makes it grow a bit.
Okay, so that's why if you have a family of HRT,
of breast cancer, you're more likely to get it, and so
because it'll bump it all up. Okay, now the weight gain thing.
Oh my god!
Right. So on estrogel, personally, because. When I first started taking it, and I was doing 4 pumps a day, I put on 2 or 3 kilos, which is not a lot, but because I work in fitness and I really monitor my weight.
We're just going to have to agree to disagree about this one. We're just going to have to agree.
Did you not say it makes you a little bit more curvy?
we're just going to have to agree to disagree, because all of us are different shapes and sizes, okay?
Yeah.
We are all different shapes and sizes. And at around the time of the menopause, yes, you can put on weight. And that, again, is multifactorial. It's to do with your genes. People may eat more at that time because they may be a little bit more unhappy. Their exercise tolerances may change. And so they're less able to run as far, do as much exercise, but they are still eating the same. And a bit on hormones, because we know that the central obesity, the central deposition of fat around the tummy may well be related to hormones. It is multifactorial.
But it's not specifically because you have menopause that you put on weight around your middle. Because people often say to me, "Oh, I've got fat stomach because I've got menopause."
What do you mean, because they've got older, or because they're no longer having
menopause?
Because they're not having periods anymore.
I don't know why, but they say, well, when you get menopause, you get a big tummy.
No, well, it's just
that's not.
It's a lot of. There's a lot of. It's contributory.
Is it?
It's not the only factor, because look, men don't go through menopause and they get a bit fatter as they get a bit older.
It's because they sit on couches a lot, then. And because they buy motorbikes instead of going for walks. Midlife crisis. Right. The HRT latest studies with it says that the rates are higher for
the latest. I think the one you're talking about. That's not really changed what we know. That's not changed what we know. It's not changed the latest guidance. All it's saying is the risk of breast cancer may be longer after stopping HRT than we thought.
And has that got why?
Not too sure actually why, but that's just what the study has shown, is that the persistence of the increased risk of taking HRT just seems to last a bit longer than we thought. But it doesn't mean that there's more cancers.
Okay. So in conclusion, give up wine, work out, make yourself do it.
Don't smoke.
Don't smoke. Don't eat pies.
No, you can eat pies.
No one should ever eat pie. They're disgusting.
No, apple pie?
Well, apple pie, if you make it yourself at home, you know what's in it.
So you can't have pie then?
Yeah, but don't eat, pies, pies from pie shops. Somewhere.
You can have pies.
You can't have pies.
You can have pies.
But you can have pies, but then you have to deal with the consequences of having pies.
Yeah, but it's just part of your diet. You just don't have to have lots of pies. You can have a bit of pie.
I don't think you should have pie.
Okay.
Any questions?
No. We haven't spoken about We haven't spoken about bioidentical HRTs. I thought it was the whole thing was that you were meant to be. You were asking me about bioidentical HRTs.
Right, bioidentical.
What does it mean? What does it mean?
Okay, so let me ask a question.
Yep.
I have to ask the question. So, is it better to take bioidentical gels, or manufactured HRT pills? Why is there a difference?
Okay. So all I'm going to say about this matter is that
don't eat pie. Yeah.
Is that bioidentical HRT is available from your GPs, from your consultants in the hospital. Estrogen bioidentical HRT comes in the form of gels and patches, and it's the same stuff that you make in your own body.
So the estrogen thing, you think it might be slightly better or more compatible with your body?
What?
Than the estrogen,
the patches,
bioidenticals.
The bioidentical HRTs that we prescribe in the hospitals and in our surgeries, the gels and the patches are exactly the same as the stuff that you used to make when you were a bit younger.
So gels and patches are similar, whereas the pills are a different thing.
The estrogen pills, yeah, because it's going to go. You can eat it. It's going to go into your tummy. It's going to go into your liver, and then it makes an active metabolite. But the gels, that's just the real deal. It goes straight in. There's no middleman or middlewoman.
Transdermally.
Mm-hmm. And then we can give progesterone bioidenticals as tablets.
Okay.
That's it. End of story.
Ask us questions. Send us any questions.
Oh, there's links. There's links to really good resources down. No, resources down here. Stay off too many forums and look at these resources. British Menopause Society, Menopause Matters, American Society of Menopause. Really good.
And remember that gossip and just too much gossip is bad.
And you can post questions. We can't answer questions about specific cases, but we can just argue about.
Just ask us general questions, and we'll sit and have this discussion, and I'll ask them properly so that you get an answer.
Bye.